Hi, my name is John Blevins. I am a professor in the School of Public Health at Emory, where I direct a program called the Interfaith Health Program. And at the request of my colleague at Candler, Letitia Campbell, have been asked to videotape this Zoom webinar with a Candler alum, the Reverend Kim Jackson. Kim is a 2009 graduate, right, Kim?
That's right,
Okay.
yeah.
Okay. 2009 graduate of Candler, and she is now an ordained Episcopal priest here in the Diocese of Atlanta, working as the pastor at the Church of the Common Ground. Welcome, Kim.
Hi, John. Thanks so much for having me.
Absolutely. Thank you for taking the time to do this. I know that you're busy and that your ministry continues in really important ways. So thank you for taking the time to be part of this.
Absolutely.
We'll take as long as this takes. We're thinking maybe about 15, 20 minutes, but if it's a fruitful conversation, we'll go as long as it needs to. I thought we'd start, Kim, if you could just describe for the students in this Canvas group, describe the Church of the Common Ground and explain before the outbreak what the church, what the mission and vision of the church was, what it saw itself to be, and what was it doing.
Sure. So the Church of the Common Ground is a church without walls. We meet in Woodruff Park on Sundays for worship, and then we do programming throughout the city in various places during the weekday. And so the real mission of Common Ground is to be a church, a spiritual community explicitly for people who are experiencing homelessness in the city of Atlanta. So every Sunday we get together, and where we stand, we declare it, name it as holy ground that we are standing on, and we celebrate Eucharist and our church together in that space each week.
Cool. And what kind of programs do you do during the week aside from worship?
Yeah, so on Mondays and Wednesdays, we do morning prayer. It's actually in conjunction with Central Outreach, so right across the street from the Capitol. On the platform or the patio of Central, we do morning prayer there, and then we also provide some food, some simple breakfast things like eggs and coffee, and it's a really good and important time where we get to do some real check-ins in terms of pastoral care conversations. How are people doing? When it's cold outside, especially, that's the time where we try to encourage people to get on a bus and go to a shelter. And for those people who we know just aren't going to do that, we also tend to try to provide a little bit for their physical needs. But fundamentally, we are a community that serves the spiritual needs of people, which you can't really detangle physical needs from spiritual needs. So it's a fine line. And on Tuesdays we run a foot clinic, and during the winter it's at Gateway Center, which is the kind of the entry point for anybody who's experiencing homelessness. If you want to receive services, Gateway is the major entry point. And so there on Tuesdays, we see about 30 people, and it's a non-medical foot clinic where we wash people's feet and, of course, direct them to services if they need additional ones, but really try to care for people's feet while also caring for their spirit. So we have really great conversations, because if you've ever had your feet washed, it's really intimate. And so people are appreciative, and it's one of the wonderful things that we do as a part of the ministry.
Is the foot washing explicitly reflective of the liturgy of foot washing, or is it less formal?
It's much less formal. I mean, it really does. It's a clinic. I mean, it feels like you're getting a pedicure, in a non-traditional setting, obviously. So we do often pray with people when we're finished. And I mean, if you've spent any time with people who are experiencing homelessness in Atlanta, you'll know that vast majority of people come with some type of spiritual and particularly religious backgrounds. And so they come expecting to have, like, they want to talk theology, right? They want to sing hymns. They want to, like, they know, they see, I'm not wearing a collar today because I'm at home, but they see the collar, and so they know, they're like, oh, you're doing what Jesus is doing, and so they want to talk about it. But fundamentally, there's no liturgy around it. Like, we invite people to sit down, take off your shoes and socks, we care for your feet, and we trust that the Spirit is there.
Cool.
Yeah.
This may reflect my own kind of theological predilections and biases, but I would say there's something deeply liturgical about that, even if you're not following a formal liturgy. That, that's the
Yeah.
little B Baptist that still remains in me, I guess, from my childhood. Thanks, Kim, for that description. Uh, as I understand it, you can correct me, but as I understand it, your direct worship programs and communal gatherings are shuttered now because of COVID. And you're still providing for some kind of pastoral support in socially distanced ways or physically distanced ways in one-on-one kind of instances as people have need. Is that right?
That's right. And we are continuing with food on Sundays. So we still meet in the same place at 1 o'clock, but instead of having a full service, we provide the lunches that we always have. I mean, now we're providing many, many more lunches, but we do continue to do that. And that's where a lot of the pastoral care gets to take place because as you can imagine, we're serving a community which very few have cell phones. You know, very few are able to message me via the internet, and so Sundays are really crucial touch point. I mean, a non-touch point, a critical connecting point with our parishioners.
Great. So I want to switch gears a little bit and just build off of that. Things have changed for your ministry and for your congregation since COVID. In light of this outbreak, what do you see the ways in which services for those who are experiencing homelessness have changed in Atlanta, and for the communities of people who are experiencing homelessness? What are their greatest needs during this outbreak?
Yeah, so I think fundamentally COVID has exposed um, to the bare bones just how broken and how fragile our social safety net is, and really how absent it is, frankly. Um, I did a talk recently with a group of people, and the way I described it, you know, historically, and by historically I mean 3 weeks ago, all of the services are, you know, the vast majority of services for people experiencing homelessness were provided by people of goodwill, often people of faith, right? Churches, um, other religious communities. It was people of good faith who were volunteering to provide food, who were providing the tents and the blankets. All of that really was basically volunteer services because there is not an actual social safety net, right? And so as soon as COVID came and it became clear that it was dangerous, that it's literally dangerous for volunteers to continue to do the volunteer work that they're doing, those services are now gone. So it used to be, we used to say in Atlanta that if you're experiencing homelessness, you might have a number of needs that aren't being met, but you will never go hungry. We used to say that all the time. I can no longer say that. People are, in fact, going hungry because people of goodwill, while we still remain good people of goodwill, we're sheltered in place. We can't go out in the same ways. And so I think that's one of the places where we see a difference in service providing is the absence of providing services as it relates to food. And then a big piece also is around access to information and access to healthcare. So the first week that we introduced social distancing practices to our community, and I think this was probably true for people who have greater access to information too, but it was particularly true in my community. What are you doing? What are you talking about? We can touch each other, you know, like that's not a problem. Like just come on, let's hold hands like we always do in the circle. Um, and and I've watched it has gotten better over the weeks, but there was a lag time between, I think, when the majority of kind of traditional public kind of got a sense of like, oh, we need to socially isolate, particularly those of us who are living in the city. There was a significant lag time between when those of us who could reach media began to really take on those practices and when people who were living and experiencing homelessness did. And it's all because of a lack of information, right? Like you think about how access information, it's either, you know, through TV or social media or something. But for many of them, they don't have that. And so that lack of information, I think, fundamentally has put people at risk in really significant ways in terms of their health. And then this leads me really to health risk. So in Atlanta, there are opportunities to receive healthcare if you are experiencing homelessness or if you're poor. There's the Good Samaritan Center, there's Mercy Care. These are wonderful organizations that provide a lot of the basic needs, healthcare, medical needs for people who are experiencing homelessness. However, Grady has also been a substantial and significant provider of healthcare, the emergency room especially. And so, particularly when it's been cold or when people are needing a break from sleeping on the streets, the Grady Emergency Room has been the place that people went. And that's no longer available to them. And so you've missed that, and it's no longer available to them to provide respite, but it's also no longer available to them to take care of other medical needs. So, with me, if it's allergy season for me, so I often get ear infections, right? So I could telecall my physician and get an antibiotic prescribed to me, and I'm good to go. For men and women and people living on the streets, historically they would go to Grady for that, but they can't do that now, right? And so just this Sunday, we placed our lunch down on the table, and a man picked it up and he asked, Pastor, can you talk to me afterwards? And so I went over and I talked to him, and he says, I know you can't touch me, but can you please just pray for me? My ear is just, it's on fire, and it's just so bad. And you could see, it was clearly infected. And he's like, I tried to go to Grady, and they're like, they can only take people who are really, really sick. And so he's like, could you please pray? And I will say, like, theologically, and I imagine we might talk about this a little bit later, theologically, I'm not necessarily one who is inclined to lay hands on someone and ask and pray explicitly for, like, healing in a direct way, right? Like, I may have a Candler education. I'm an Episcopalian, so I have some fancy language around medical care and asking that there would be wisdom for medical providers and things like that, right? But on Sunday, I had to pray for a straight out miracle, right? Like, I couldn't. They're not medical care professionals who can intervene and help fix his ear. Like, I prayed for him and called on God to, like, do a straight up miracle, which lets me know I still have that in me. I still have that hope, right? I still have that faith that is something that's possible, that we can call on. But it's only because we have such a fragile medical system that was even necessary, right? So I guess to sum up your question, I think we're seeing there's a breakdown in access to food for people who are experiencing homelessness. There's a breakdown in access to medical care. And I think we'll see this more as it goes on. There will be a breakdown in access to medications as well. So many, particularly of my congregants, their stability is dependent on getting the medication for their mental health issues that they need. And I suspect in the next couple of days and weeks, we'll see that access has been limited. And so we'll see some additional problems because of that.
Thanks, Kim.
Yeah.
It's a powerful description and a sobering one to think about that. Are the clinics, is Mercy Care still open, or Good Samaritan?
Yeah, they are both still open. But again, like, they just have to be super careful, and people aren't getting the kind of regular, a lot of people who have some significant chronic needs go to Mercy Care or Goodwill Good Samaritan clinic every week. Like, it's the thing they do. They wake up and they go stand in line at 7 a.m. and they see their doctors for touch, and that's just not available to them in the same ways anymore.
Thanks.
Yeah.
Thanks for telling that story. It's going to take us into the last question, which is a shift of gears in some way, but in another way, you actually have already brought us into that place. And this is a theological question, and it just invite you to take you where it takes you, and that is, how has your faith affected how you understand COVID, and how has COVID affected how you understand your faith?
Yeah. So I think um, I'm going to answer this in kind of around the ways here. I think fundamentally, I've had to get really, really clear about the pieces of my faith that really matter, and particularly the practices of of faith and spirituality and of being pastor and priest. All these things are related, and if you before COVID, if you had asked me like, what does it mean to be a priest? What's kind of required for you to priest well in the community that you're in? I would say, well, we celebrate communion and we celebrate communion. I think that I think I would have started there. I mean, I'm an Episcopalian, and also that we see each other and that we are present, right? Like I would talk a lot about presence, and I would mean that as in my physical presence, right? And I think that's actually been a very common way that people have thought about what it means to be a pastor and a priest along the way. And so COVID has really kind of forced me to strip away that and see like, okay, I can't be physically present for my congregants. I can't even be virtually present for my congregants. And so I've had to get really clear about what does it mean to pray for them? What do I believe that prayer can do and is doing? Prayers that they don't get to hear, right? Like the prayers that are done here in secret, if you will. And I think COVID has really just forced me to ground down and say, like, as liberal and as progressive as I am, I do still fundamentally believe that the spirit can transcend and be present and in the midst of a people, even when we can't be incarnate with one another. And I think that's been really important. And I think that, my faith lets me know that we'll make it through this on the other side, right? That there is another side. I think that I often refer to COVID as the plague, and I think about the Old Testament, which is as someone who studied Black liberation theology, the stories of the Exodus and the plagues that preceded it are fundamentally and core to how we think about oppression and systemic oppression and how people get through. And so I think I find myself saying, okay, like this has exposed and made us laid bare so clearly all of the systemic oppression and systems that seek to bind people, and particularly people of color, right? Like we can see that writ large now. And so what is, when we cross over the river, metaphorically speaking, so when we're no longer socially isolated, when we're out of quarantine, what does liberation look like? How do we make sure that the look the same anymore, and that people can have access to the healthcare that they need? And I keep thinking about how um, if I didn't have some sense of faith in kind of the ultimateness of goodness, right? That like there is good that will come out of this, then I think I'd probably be a pretty depressed person in the midst of this. And so, I mean, those are some of my ideas and thoughts. I have, this is like a random aside for people who are a part of liturgical communities, but I realize I don't really give a the church calendar. Easter will come when Easter comes, and it is not bound to a calendar that we've created, right? Easter transcends that. Just a lot of things that I think that we thought were important, I'm clear, no longer are. Yeah. Where are you on this, John? I'm just curious.
Uh, the stuff you were thinking of, a couple of things, reflecting back on what you just said. One is that it strikes me that you are a really good jazz theologian, and that you're a good improvisationalist. You let that kind of stream of consciousness carry you to where it carried you. And it was really beautiful. So thank you. When you were talking about praying and your congregants not being able to hear it, it reminded me of the communion of the saints, and that that part of what we're trusting in, I think, is that these moments are relying on the Holy Spirit to be the Holy Spirit when we can't embody what we're called to through physical connection, and that there is a spiritual connection that should inform our desire for spiritual connection, but now we can't do that. So we have to, calls us to ask some questions about how much we really believed about all that spiritual stuff, because the stuff that usually counts and is concrete is the stuff that's concrete is what in this world is what usually counts. And in this instance, we can't rely on that. So I think it's raising spiritual and theological questions. Your comment about praying, laying on of hands and praying for the man who had the ear infection is an example of that. Like, what does healing and a prayer for healing mean? And what are we praying for when we make that prayer? That's a profound question. And part of it is it seems to me that coming from the world where we are, where we're supposed to believe in medical science, and our religious traditions and spiritual traditions are supposed to give symbolic credence to the real stuff, the concrete stuff, that in this instance, you were reflecting that what was real and was going to be able to be have an effect on the spirit and the body was prayer, and not the prescription of a medical provider. And I think that stretches our faith in what it is we say we believe in really profound ways, not just on the religious side, but also on the medical clinical side. And then finally, I would just say that I completely agree with you that the thing I keep thinking about this virus is it has just laid bare just how many principalities and powers have erected structural sin, and that there are systems of domination and systems of inequity and systems of disparity that I know I have benefited from in my life, and that it makes very clear to me in a way I've not experienced here in the United States the reality of that, and calls me to imagine what our society, our culture, our communities will have to be, if we are going to be able to pray anymore in any way that's faithful on the other side. And then I'm doing a lot of work globally on the response. And so this question of just how much the guidance about infection control reflects a first world model of households and socioeconomic assumptions, and what it means to live in a household and an informal settlement, and the protocols we have in place are just completely useless and impractical. It brings that question back up to me in the question of the global church, and who are we as sisters and brothers in Christ to those women and children and men in those communities. So
yeah, I've also been thinking a lot. So I think I've spent a lot of time as a preacher dreaming about a new world, and saying over and over again, I believe that a new world is possible. I believe that we can do better. I believe that, children can receive the types of education that they need, that there can be healthcare for everybody, et cetera, et cetera, et cetera. I believe that is possible. And as I've watched this like multiple $trillion package manifest itself from the sky and descend down upon us, I feel like oh, see, another world is possible. Now what it will translate into, I don't know, but another world is possible. And and I'm so hopeful. I am so hopeful that this will be the moment where we will insist, and that's the only way it will happen, is that we insist in living into and creating this better world. But now that we know that money can just be kind of created, I mean, that's what's happening, right? Like, money's just manifesting itself. Now that we know that, I was telling a friend, my insurance company has said to us that testing for COVID is free, but also should we be hospitalized, there will be no copays and we will not have to do any co-insurance. So essentially, if we get COVID, our medical care is free. My insurance company is offering that to every single clergy person who is on the medical trust plan, right? Now, if we can do that during COVID, right? We can do that when somebody has breast cancer, or when somebody, hell, like when somebody even just has an ear infection, right? Like, these things are possible, and we're seeing that. I feel like we're just getting a taste, like, of what is possible, and I get a lot of hope from that. And I think I get a lot of imagining and thinking about rally together to insist that this type of access that we've now suddenly opened up to so many people, that we maintain it and that we continue to push for it, because we now know it's possible. It's not just a dream anymore, right? Like, we're watching it happen. So
That is
yeah,
a scatological vision right there.
there we are.
See, we got back. We got back to the big words that Candler teaches students too.
That's right.
Well, thank you. Are there any final words you want to impart to these students who are watching this? Anything to say to them?
Yeah, I think that if you are sitting in a place where you don't feel like there's anything that you can do, if you've listened to this and said, wow, I wish I could be out there on Sundays and helping to feed people or whatever, but I can't do that, I hope that you have heard just how much prayer does matter. And that I believe that as people of faith, as future clergy leaders, or however it is that you choose to make use of your seminary degree, I think that we are especially gifted in doing this spiritual work. There are medical providers that I am so grateful for, who are trained to take care of our physical bodies. And if there was ever a time for us to like access the spiritual gifts that we have, it's now. And so I hope that in the midst of you feeling like you're not able to do anything, that you realize, no, activating the spiritual gifts that you have is exactly what you're supposed to be doing, exactly what you're called to do.
Thank you. With that, we will wrap this up. Let me only say to you, blessings in your ministry and in these days.
Thank you, John. I really appreciate this time.
Thanks. Thanks so
Blessings.
much, Kim.
Absolutely.